Good morning if you're watching this in the morning, but you're probably not. It is May 8th, surgery day, and I woke up at 4 o'clock in the morning because I couldn't sleep anymore. I will say that gabapentin didn't really make me feel bad or good or anything. I don't know. If anything, maybe I slept a little bit more than I would have, but I was up at 4 o'clock. We have our glasses on today because you can't wear contacts with surgery, so I already put these on, so I'm ready to go, although I have my contacts with me, so as soon as they say go, I'll put them in. I hate wearing glasses. Nothing about looking weird or anything. I just like having contacts. It's easier for me to see everything. And that's about it right now. I'll show you a little bit what I've prepared. So let's take a look. I did not prepare Turtle, but she's looking so cute, and I'm gonna miss her so much over a couple of days that I'll be at the hospital. But Phil will come and feed you, Mama. Mrs. here somewhere, I can't find her, but thank you. Thank you very much for love. I'll see you soon. Who doesn't love that face? All right, since I know I'm gonna have at least a 1 night or 2 night stay, I packed a little teddy bag. It's not a big suitcase, it's just a little suitcase, but I have my pajamas in here, I have shorts in here, I have those stupid pants with the buttons, which I don't think I'm gonna wear because it's so hot right now, and I don't know if they'll be a good idea, but I brought them with just in case. I also brought some weird pillowcases, brand new clean ones, because they said that we could actually bring our own pillows because Phil's probably going to stay the night with me. The pillows are in the car already, but I brought new fresh pillowcases, so if they say anything, I'll be like, I have a fresh pillowcase. So they don't think I'm going to bring contamination in. Just trying to think of everything. So that's my overnight bag. And then I've got this little bag, which has my Bible, because I do Bible study every day, and my iPad, of course, to keep me busy if I'm, for any reason, bored. I don't think that's going to happen, but and my retainer cleaner, my retainer for my braces. And of course, I brought the selfie stick, just so I can take some video if I can handle it. If not, Phil might do it. And then we have the medical bag that they gave me, which has all the medications in there just in case I need them. I don't know if I do or I don't, but I brought them all, and my checklist and all the paperwork and all the junk. So I think we're pretty good to go there. And then I have one more thing downstairs. All right, downstairs, I have to drink the rest of this, excuse my language, crap. No offense to Powerade, I just can't stand the way it tastes. But I only have a little bit left I have to drink. And then I packed a little frozen lunch bag. I'm gonna open this one. Whoops. Maybe I can't. Hold on, people. Sorry about the camera. And here I've got 3 bananas, and I've got 2 peanut butter and jelly sandwiches. And you might say, "What, are you going on a picnic?" No, I'm bringing this because I don't trust hospitals. I've been to a surgery, like I said, but I'm vegetarian. And if for some reason all the food they have is, hey, here's a hamburger, it ain't gonna cut it. I'm pretty sure hospitals can handle vegetarian, but if they're not prepared for me today, I'm prepared for me today. So that way I have something to eat when they say it's time to eat. And if they have no other options, I can have that. And if not, Phil can have some. So we're ready for something to eat later. And no, I'm not bringing the Girl Scout cookies with me. Well, we're on the way to the hospital. I'm trying to have the Rocky song in my head. You know, da-na-na, da-na-na, da-na, da-na-na. I'm trying to be like, da-da-da-da-da-da, da-da, because I'm trying to pretend like, new knee, Bionic, da-da-da-da. That's Bionic Man.
Yeah.
I'm trying to be really positive here that I'm going to have a new knee. Woohoo! And I'm going to be bionic in a few weeks.
New and improved.
But, new and improved, Phil said. Say hi to the camera really quick before you, I don't want to look at the camera while you're driving. All right, on the way to the hospital. Let's see what that looks like. By the way, here's a picture of my knee before. okay, I'm in the hospital. I'm gonna do this really quick because the nurse keeps coming in and I'm not sure what's gonna happen next. They're gonna give me some kind of a block in my leg. And I already have my IV and I have antibiotics coming into me. Retainer coming out a little bit and then my glasses on, and that's really all I'm gonna post right now, and then we'll see you after surgery. Bye. Hey guys, my throat's a little sore, so because I had to do those oxygen tubes down my throat, but I'm okay. It was 9:30 p.m. My surgery was at 11:30. Let's see. When I first got to the hospital, I had to wait in the waiting room for a little bit, and then they brought me into a prep room where they asked a million questions, of course, and they also let's see what else they did. They put the IV in my hand, and I think I told you this already, and they put me on antibiotics, and they also gave me some anti-nausea in case I get sick from the anesthesia. Right? What am I gonna feel? I'm tired. When I woke up, I was really out of it, like really out of it. I could not keep awake at all. And it felt like a million people were coming at me with things, asking me questions and all sorts. It just seemed like chaos to me. A woman actually came in to show me how to use this breathing apparatus that I have to use once every hour, kind of like this. So she told me how to use it, but Lord knows I can't remember what the hell she said, so I had to re-ask after I was more awake. I did not throw up. I thought I was going to. I was very nauseous, very dizzy. Here's what it looks like down here. They've got this, which is they're gonna get a machine here shortly to do the compression on my left leg. And here's the operated leg. It's full of ice right now, packs. And it hurts like hell. The therapist did come in earlier today. They wanted to get me up and walking, but the minute I sat up, I was really dizzy and really nauseous again. So they decided to not do therapy today, and they're gonna do therapy in the morning, which sucks. It's kind of sad that my leg hurt so bad and I was so nauseous. By the way, I apologize. This is the real deal. Like I said, I'm going to say the real thing, so hopefully nobody gets offended by all this. I hadn't eaten anything since last night, and I brought myself that peanut butter and jelly sandwich. They said I could have it, and it was drier. My mouth is still right now so dry. I don't know why, but I couldn't even chew the peanut butter and jelly sandwich. It was just like chew, and I couldn't get it down. So we ditched that. I managed to get down 2 bananas because they're moister, and I was able to eat those, which was good. Because I think I was also nauseous because I was so hungry. They gave me the hydrocodone. I think that made me sick again, although I didn't. Although I have these lovely things ready to go if I have to. Check it here. So at least I didn't throw up, which is good, I guess. But it was still very nauseating, the hydrocodone. So tonight, the nice nurse here, the nurses are very wonderful here. Instead of hydrocodone, they're giving me like super Tylenol, like, you know, just the highest dose Tylenol you can give, and hopefully that'll help, because I don't want to take the hydrocodone not because I'm scared of it, it just makes me sick. I kept my glasses on because I don't feel like putting my contacts in yet. I'm gonna do that tomorrow, and I did manage to get my retainer back in my mouth, which is good, but I had to brush my teeth in bed, which is kind of weird. And all these things are weird to me. That's pretty much it. Phil, can you think of anything else? I can't think of anything else.
No, surgery was about 1 hour or 54 minutes.
Surgery was 1 hour and 54 minutes. Dr. Debbie, I almost said his name. He said everything went well to Philip. So that's, I guess, good news. Now it's just a matter of healing. So I'm just gonna get some rest tonight, and then tomorrow all the fun begins. And I'll report back sometime tomorrow on that. Just want to thank everybody for their well wishes. I got so many comments on the YouTube, not so many, but I mean for what we have. And thank all of you for your prayers and your kind words. I'm sitting here saying, why did I do this? But everybody says that's what you say, and then it's worth it in the end. So hopefully it's worth it in the end. Right now I'm just like, why did I do this? But that's what you're supposed to say. All right, I think that's it for today. And we will talk to you guys sometime tomorrow. Have a good night.